Hi, Gibson and Kohli coming to you from Snackable Health, and I'm so heartened to hear this pile. There's that big ice bucket challenge for people to help fight ALS, and it kind of paid off. Talk to us about that.
It did really pay off. In fact, it's opened the door, I think, to do more of these type of fun social media challenges. So this is probably one of the first demonstrations, at least as far as I know, where, crowdsourcing using this kind of a social media challenge to raise money actually funded research of a drug for ALS or Lou Gehrig's disease, also known as amyotrophic lateral sclerosis. And the drug got FDA approved. So I think it's really cool that we did this, and I think we're onto something here. My reservation about the crowdsourcing and crowdfunding is that we really want to try to use this money to fund studies that would not otherwise have been funded. Because the idea here is not to save big pharmaceutical companies money if they would have paid for the study anyways, but really to try to fund research, maybe research focusing on disparities, focusing on access to care, focusing on things that may not necessarily get all the funding that they deserve.
Paul, can you tell us a little bit more? I mean, how many people were studied? Tell us a little bit about the drug. Can you tell us a little bit about how it worked and how beneficial it was?
Yeah, so ALS is an unfortunate condition, Mike, as you know, where 90% of patients who are diagnosed will pass away within 5 years of diagnosis. So really grim prognosis and really sad to see your loved ones struggle with ALS. It's a condition where you get cell death, basically the nerves that control our body and the way that it moves start to die. So it's motor neuron death. And what that leads to are things like paralysis, inability to talk or swallow, trouble with aspiration, your secretions going in the wrong directions. So you really see a pretty rapid decline. So this drug was designed to fight the cell death that occurs from the nerves that control our movements. And the study was actually a phase 2 study, which, as a clinical trialist, you're familiar with, is really a study that is supposed to be proof of principle. You're really supposed to just kind of lay the groundwork for a bigger study that then studies the safety and the benefits of the drug. But in this particular case, even though the FDA had initially decided not to approve the drug based on the phase 2 study, they did a 180, changed their minds and said, well, we don't have a lot of options when it comes to ALS. So let us go ahead and approve it. But I'm curious, what do you think about that move and what it means for other drugs and for the drug companies as well?
Well, traditionally we do a phase 1 study. Is it feasible to use this? Phase 2 is like, is it safe? Are there any side effects? And then phase 3, we test out, does this really work? Is it effective? But more and more, Pyle, I am seeing development programs where if it looks like you can give the drug and it looks pretty safe, you go straight to see, does it work? Straight into that pivotal trial to get the drug approved. I think that's great. I mean, we don't want to delay, the treatment of ALS or heart disease. I think it's great that we're moving ahead more rapidly, particularly in patients who don't have options like the ALS patient. So I'm glad to see the FDA begin to, allow the introduction of evidence in this more rapid evaluation process. I think that's a great thing. So good news for patients. I'm sure we'll hear more about this. Thanks, Paul, for the update, and thanks for joining us here at Snackable Health.